So here we are back again. We're going to talk about doing this lower first molar, which is actually one of the teeth that we actually have a study in process of being published. Dr. Hernandez over in Austin is going to be publishing that. He's already got it in. It needs to be reviewed and go from there. So we are going to talk about that lower first molar. And again, a lot of people would just make a flap. And if you have, tooth resorption, if you have a wickedly curved root, then you have to do something like that. But in general, if you have a radiograph that shows that you don't have severe ankylosing, then you can just go ahead and do it like this. So I'm going to use a little bit of a scalpel blade just to kind of open up the attached gingiva, but then after that I'm just going to section it and use an elevator. So I'm going to go ahead and bring this up a little closer here. Don't get seasick on me here. Make sure that this is going there, that our lights are good. And so we're going to get started. So we don't need a lot of instruments to do this. I probably won't even use a scalpel blade. I don't know if you guys can see that pretty well in here, right? Yeah, that's a pretty good spot. So make it a little bit tighter for you. There we go. And I'll bring you a little bit closer there. Yeah, can we just bring this up? There, perfect. I don't have a professional cameraman, but I am going to reshoot these at some point. There we go. Okay. So really the first thing I'm going to do is, like we do for every extraction, cut the gingival attachment. Just like that. And then I'm going to do it on the inside too, right? Just down like that. Again, not making a flap, just cutting the gingival attachment just like that. Okay. And then what I'm going to do, can you pass that underneath there? Pick it up really quick, one of the two. Thank you. Sorry, guys. So then what we're going to do is I'm going to take my thumb forceps and I'm going to come in here and I'm going to section it, starting at bifurcation. Might get a little bright in there, I'm sorry. I'll do little circles going through, make sure I'm cutting the whole thing. Sometimes that happens with burrs. Shouldn't. Come on there. All right, I'm going to need a hand piece. Can I get a different hand piece, please? So when that burr thing happens, sometimes the burrs are a little bit off there. We'll trade out the hand piece. Luckily in this practice we have quite a few. Thank you, sir. Can I have another 701, please? Just like everyday practice, right, everyone?
Someone else?
No, we'll get someone else, please.
You got it.
Would be done by now if I had the equipment.
Yeah, you have it. You're good.
All right. Okay, back to it. Okay, so okay. Then after you've sectioned it, the first thing I always recommend you do is you take a small elevator, way down at the bottom. You want to make sure you've got it fully sectioned. So hopefully you guys can see when I turn this, it slightly moves. So what I'm going to do is I'm going to come in here and kind of twist it like that. See that? And just count to 10 or 15 or 20. It's working the entire time like that. Working really well. And I'm just going to hang there and I'm going to kind of get some purchase between those two root pieces so they're pushing opposite each other. If they don't move opposite each other, either one, you haven't fully sectioned it, or two, it's ankylosed, one of the two. So you got a problem. So if it doesn't move like that, you got an issue, and then what I'll do is I'll kind of go like this. So this is going to push the mesial one towards the bone and the distal one out there, and kind of do the same thing here. And then we're going to come in from the front. And what I find on this tooth right here, the mesial root's bigger, and what really holds it in is right on the inside of this lateral, or this mesial root, right on the inside of that P3 is what really kind of holds this up. So if you can kind of get into this front corner, it's kind of a challenge sometimes. You can really, without hitting that tooth there, so get in between the tooth and the bone, and then if you can get into that area, it does a really good job. But I'll come in here. Again, as long as you're between the tooth and the bone there, you're okay. And then again, just to give a gentle twist like that. And again, count to 10. And one of the big things is, like I showed you guys with that canine, push in and go the other direction. And then in here like that. And now I'm into that little spot in the front there, which is great. And then work a little further in there like that. In here like that. And then there's one. Okay, so there's one. And then on this side, I'll come in from the back side here, because again, remember, I don't want to hit that third incisor there. So I want to come in from the back here and get below that, so I'm on the bone. And the same thing, just twist in there. Again, it's all this pushing in, because again, these are luxating elevators, remember. I'm pushing in firmly, twisting gently. And this distal root is smaller, so it's a little easier to get out usually. And again, with these kind of rounded teeth, I don't mind a little twist and hold once you got it started. So I'll kind of grab it down here, and give a twist, and again, count, hold to 10. I'm pulling out firmly, twisting gently. Almost there. There you go. And then it should be nice and loose. And then pop it out. That. There's the other one. Okay. And then really, I probably won't suture it tonight, just because I'll save the suture. But all you have to do here now is kind of lift this up like that, and lift this up like this. And you don't, again, this doesn't have to close primarily, but you want to get it close. So you want to lift up this tissue here. And then what I'll do for this tooth is I'll do what's called the blind fenestration. And so you can't see the periosteum, so I'm going to come in here like that, that, and that. And you can see that releasing a little bit. I kind of do this on the inside as well. Same thing there. You kind of come in like this. And again, if you want this to close edge to edge, then you have to make a true flap, which I don't want to do. And then when you've got that closed over like that, I'd probably take away a little bit of that bone there. Maybe release this just a wee bit more. Sorry if you guys can't see very well, it's a toughie. But I'm just kind of separating the tissue planes and just kind of snipping it like that. You see it slide over like that. And then I would throw a couple stitches across there and be done. So that is without the technical difficulties, which happens to the best of us, unfortunately. Without those, that probably would have taken about 3 minutes or so. So again, people always say, well, you can't do this with all teeth. No, you can't. You have to pick them. And a lot of it really comes down to knowing how much pressure you can put on it before it breaks. And really the way you know that is doing a lot of extractions. Unfortunately, there's just practice. But if you take a look at the x-ray, you can see that periodontal ligament all the way around it. It doesn't look ankylosed. It doesn't have a big hook on the bottom. These things work quite well. Again, young dog, skilled surgeon, so don't expect it to be that short. But with practice, especially, taking a course would certainly not be a bad idea. So speaking of which, in the new year, I'm going to reshoot these because those weren't the highest quality videos. I just wanted to prove it to you guys that I can do it live as opposed to recording it and like, will he cut it? No, I can't. But I'm going to have a professional photographer come in and video these techniques. And I'll also do some deciduous extractions, and maybe we'll look at cat too. But look for an announcement in the new year that I talk about going online, watching they's again, and then taking a test and getting CE credit. There will be a charge for that because we have to pay for the CE credit, but it'll be free to watch if you want to watch it. But we'll obviously announce that here and on our LinkedIn and all that kind of stuff as well. But yeah, bottom line, those are the 4. If you guys missed any of the other ones, they're all on, they're all saved on here as well as our YouTube channel. So I'm going to grab this thing off here. I'm going to take a look and see if there's any questions in our comment section. Teach my residents here. I don't know why you would be afraid of using the drill. You have to. Unfortunately, I know a lot of people are afraid of power tools, but they're very safe. You just have to use them in the right way and make sure you hold that gingiva back, but you can't section teeth effectively without it. And really it comes down to a knowledge base of anatomy and learning the anatomy, getting a skull, or especially IM3 has some nice clear models. So does Columbia Dentiform. They have nice models that will show you, but really your preoperative x-rays will tell you where the roots are and where you should make your sectioning. And again, it's all practice and knowledge of anatomy. But your x-rays are probably going to be the biggest thing to let you know about that. I'm about to see if there's any other questions up here. Hello, my Chilean friend. I don't see any other questions here. I'll scroll down and see if something came up. You are very welcome, all. So yeah, so if you want to watch it again, obviously soon it'll be in our YouTube channel. But then after that, we'll go from there. Do I sometimes amputate the crown? Not usually, because I want a handle. If I cut the crown off, then I don't have a handle to grab with my extraction forceps, and I do use my extraction forceps quite a bit. So I would say not usually. The one time that I do amputate the crown a little bit is on the upper 4th premolar of a big dog like this. I might take the tip off just so I can cut all the way down. So, but no, I don't. I know some veterinary dentists talk about doing that. I don't, because I want a handle to take it out. So anyway, all right, signing off from Southern California. Have a great night, and in a couple days this will be up on our YouTube channel if you want to review it. And like I said, in the new year, I'll get higher quality videos of these things up there and do some other things. All right, have a great night.